भाभी को सुनना है मुझे ज्यादा, so I was waiting कि आप कब खत्म करोगे। आपके ऊपर प्रेशर लग रहा था। थैंक यू वेरी मच सर। What I want to, why I interrupted, sorry madam. When we take lecture, when we are teaching you, when we talk about homeopathy, organo and how it works, it was just like an old wine in a new glass, same. But today, a live example, what homeopathy and homeopath can do. ऑस्ट्रेलिया, बेल्जियम એવી કન્ટ્રીમાં સર કહે છે કે આપણે તો નામ પહેલી વાર સાંભળ્યું હોય, રાઈટ? તો ખરેખર આપણે આજે ખૂબ નસીબદાર છે કે we have such a speaker in our first seminar. In our first seminar, when we were deciding about, you know me, when I plan or we plan, we think small things. You know, first challenge in front of us was to call to whom as a speaker, because that is the core of any seminar. Inaugural session, Hassan Baji, that is different thing. But the main thing was for us was the content of seminar, and for that speaker were very important. Really today I am very happy that we have such a good speaker in our first seminar. Oh, जोरदार तालियों हो जाए. And you see the chemistry of both. મને તો રણવીર અને દીપિકા યાદ આવ્યા કરતા એન્ડ આપણે મટીરિયલ મેડિકલ complementary relation. You can see exactly same. You know, sir is acute, madam was chronic, like that. You know, complementary. So what I have no words. Really, sir. I mean it. मतलब beyond our expectation. અને એક પણ સ્ટુડન્ટ સેજ પણ હલ્યું પણ નથી, આંખનો પલકારો પણ કોઈ લીધો નથી, એટલું પેશન્ટલી સાંભળી રહ્યા છે અને they are more eager to listen. ભાભી, so please welcome.
This is usually the case. I always end up getting the most boring session, either immediately after lunch or just at the end, when people really are tired. When we were, at with Dr. Shankaran, when we were HRC, TOS, so at that time it was the norm that Bhavisha has to be given a session which is the most boring. And I took it up as a challenge that if I can make that most boring session interesting, then it's worth it. And then they said, yeah, that was the idea, that you're the only one who can keep everyone awake. And if nothing works, if homeopathy doesn't work, we can all play Garba. That solution is always there. So anyway, Sachandra has done all the interesting bits, yeah? He showed you all the lovely things and everything. So I only have to do a lot of the hard work, which is teaching you materia medica. So let's see. But just before we go, I want to just add one more thing. This is in Gujarati. Yeah? By the way, I am a Gujarati, he is a Maharashtrian. And very rarely in Bombay, of course there are many Gujaratis in Bombay, but as a family, we hardly get to speak Gujarati. So I will try and speak as much Gujarati as I can. મને બી અવસર મળે ગુજરાતી બોલવાનો. તો આ કોણ ફર્સ્ટ કોણ મારા માટે આ વાંચી દેશે? This is very easy. Sachandra has already covered up a lot of things for you. Yeah, why is everyone laughing? કોણ લખેલું છે? Acha, he's already showed you things. I want to just add a few important things to the vision. Remember, he said vision is very important. And I would like to say one thing, just add to what Sachandra said. Of course, the woman always adds more, right? We are the better half. So we have to add, right? God made Adam. Then God said, I can do better. So he made Eve, right? So just to add that one of the most important reasons why Sachendra and I became successful is because from a very early age, we got married also very early. 23 varas में हूँ आती and he was 24, right out of 1 year after internship. And no money. And no backing. Their father is a doctor or some kind of on either side. But we had two very important things. Vision. Vision, dream. A dream always takes you somewhere. So dream and vision, they are the same thing. The vision is the formal dream. Yeah? And planning. So I think it's not important to have knowledge. It is not important to have, information. All that is not important. What is important is to have dream and vision, and then the faith, Vishwas, the faith in your dream that you will go there. And then of course the third thing is the hard work. But hard work alone will not take you. It goes in this chronology: dream, plan and hard work, or vision, plan, faith and hard work. Yeah? So just read this for me. This is in Gujarati, what I said in English. Four marks se mara. Somebody? Some young student. And let's give chance to a new person. Yeah? You already proved your genius. With the phone, yeah.
તમારું સ્વપ્ન અને તમારી દૃઢ ઈચ્છા શક્તિ સૌથી વધુ મહત્વપૂર્ણ છે. દરેક ક્રિયા માટે સમાન અને વિરુદ્ધ પ્રતિક્રિયા હોય છે. જ્યારે તમે આપો છો ત્યારે તમને મળે છે. આ બ્રહ્માંડનો અચલ નિયમ છે.
That is exactly what I said. Sauthi mahत्वपूर्ण सूचक. So I would like to say few things. Ame દિવસમાં, so some things I can speak in Gujarati. Technical I may not be able to, but બાકી દિવસમાં both Sachendra and I keep some time for our vision. અત્યારે એક્ઝામ, અત્યારે ભલે બસ પકડીને ઘરે જવાનું છે, અત્યારે ભલે કાલે હોમવર્ક છે, અસાઇનમેન્ટ છે, રિસર્ચના પ્રોજેક્ટ છે, whatever, that is આજનું. એમાં ગુંથવાઈ નહીં જવાનું. You understand? 10 મિનિટ દિવસમાં રાખવાની કે મારું ફ્યુચર વિઝન શું છે, મારે પહોંચવું કેમ છે. આમાં ગુંથવાઈ જશો તો ત્યાં નહીં પહોંચી શકો. રાઈટ ડોક્ટર પટેલ? He had a vision when he met us. We met in 2010. But you know what Sachendra told me? Sachendra said, see, I may not teach you materia medica, but these are lessons of life. Remember that. Sachendra, we met in 2010. What Sachendra remembers is he had said that હું એક college ખોલીશ. અને this is exactly what happened. Amra, when we got a call in November 2025, 15 years later, Dr. Patel said, Amara college ma, please will you come to deliver this? So, your own principal is the best example of vision and dream. grand, which is good for all of us, right? Second important thing, કે અચ્છા દરેક ક્રિયા માટે સમાન અને વિરુદ્ધ, ઓકે, એનો આપણે થોડું અલગ રીતે લઈએ, which is the third. So Newton's law of every action there is equal and opposite. Now to add to the second one, to the third, તમે આપશો તો equal and opposite મળશે. So another thing, when we started, okay, અમે Saturday નથી જોયું, અમે Sunday. So I am speaking in Gujarati thinking that everybody is Gujarati. Is that okay or should I switch to Hindi or English? Gujarati is fine. What was I saying? જ્યારે અમે સ્ટાર્ટ કર્યું ને ત્યારે we never thought કે એક તો we had a big vision કે કંઈક મોટું કરશું, હોમિયોપેથી જ માર કરશું, બીજું કંઈ તો અમે વિચાર્યું નહોતું. અમે બી તમારી જેમ જ in the very beginning for few marks MBBS very few and we landed in homeopathy. Okay, I was already getting MBBS outside Bombay, New Bombay, but I didn't want to, so I took homeopathy because ત્યારે મને કલ્પના જ નથી the difference between homeopathy and allopathy. I thought it is the same. આમાં બી જઈને neuroscience કરીશ. But when I went in, I realized no, this is completely different. હા તો body game જ અલગ છે. But I tell you what, but I had one vision. You know what my vision was? Okay, at 25, I will start traveling abroad for work. And you know, Sachin, I got a picture there. I was 25, he was 26. And I went to Canada and Belgium to teach. So I went out for work. Okay, I didn't go as a neurologist. So it doesn't matter if તમને universe કેવી રીતે લઈ જાય છે. તમને universe ત્યાં લઈ જશે. પણ એ vision, એમાં faith, એક દૃઢ ઈચ્છા શક્તિ, અને બીજું એમને બી કંઈ સપના જોવાથી ને રીલ્સ જોવાથી નહીં મળે. એના માટે મહેનત બી અમે કરી. અને what we used to do when we were in college, and I see that today. I told Dr. Patel, I see that in all of you. Everybody is running here, helping us, you know, the teams, the committees. You are giving on a Sunday. You are here to give. કે ભાઈ આવે છે, પ્લસ સ્પીકર આવે છે, ચીફ ગેસ્ટ આવે છે, let's do this, let's make it better. When you give, તો તમને સામે મળશે. એની અપેક્ષા રાખવાની જરૂર નથી. Right? That is ગીતાનો સાર. तुम तुम्हारा काम करते जाओ. From a guarantee and experience and clinical evidence of 26-28 years of practice, કે તમને મળશે. Okay? One another little example અમારી સામે. I was telling August September I was very strongly of the opinion that next year we will start teaching in colleges because there are many seniors who know us. People across the world know us. We have schools in different parts of the world. But grassroots level India અમારે students ને શીખવાડવું છે, ભણવું છે. I want to tell them that my homeopathy can give you so much. So August September માં તો કંઈ થયું નહીં. I was planning to start an Insta. Of course, Insta will start, which I will show you. You can all also follow, and we will also follow the college so that Amara 6,000-7,000 followers will start following you, because that's how the community grows. But the point is, okay, I wanted to do like college name and then November, so August September was hard work. We were trying to figure out a strategy, and then suddenly November beginning we had just come back from Germany, and Dr. Patel called us that we are doing something and then we want the students to be motivated. Will you please come to teach? So that is the second thing. તક ક્યારેક અજાણી દિશાઓના અંધારા ખૂણાઓમાંથી પણ અચાનક ખીલી ઉઠે છે. August, September, we were trying, thinking, colleges ma jaye, this, that, whatever. By November, we got a call, right? And now there are 3-4 colleges in Hyderabad also, which are connecting with us. And we have the grassroots level for Shikravanu Salfar, because we want to start, and the scope of homeopathy post-COVID, it is mind-boggling. Post-COVID, people are really willing to take up natural medicine, alternative medicine, Ayurveda, change their lifestyle. And if people are open to the fact that stress affects, that the mind is more important than the body. એટલે હોમિયોપેથીનો સ્કોપ જે અત્યારે છે અને the power that India has, you can't believe it, because we are acknowledged medical institute of the homeopathic science in India. જે all over the world અત્યારે ઓછું થઈ ગયું છે because they are scared. So let's not talk about that. But the world is actually looking at India. અમે જ્યાં જઈએ છીએ ને abroad, everywhere people are saying, but homeopathy is flourishing in India. Homeopathy, because there are so many colleges, and we have a valid practicing certificate as a medical doctor. So you get me? That's a very prestigious, respectful thing. So we do not need to go to anywhere else because we have a very solid degree in our hand. And if we have results and we understand the patient as a whole, so we do not need to go anywhere else. This is the best time. You see, we are all, okay, we are still middle-aged, but you are the budding younger generation. Yeah, like Sachendra said, the one reason we want to take this ahead is our son is an IIT. He's not going to do it. Even if you are the, and one son cannot anyways do everything. You need the strength. Every child here, for me, is my child because you are all homeopaths. Yeah, you are the next generation for us, right? And if તમે આને આગળ લઈ જશો, તમારા પછી આગળની generation. This is what is needed. And you have to think big like this at this age. જો તમે આમ વિચારશો, તો તમે આગળ વધશો. Understand? So you see how all these things are linked. અને જો તમે આ વિચારશો, તો તમને ક્યાંકથી બી કોઈ ખૂણાથી તમને ઓપોર્ચ્યુનિટી મળશે. ક્યારેક તકનો દીવો તો સૌથી અનપેક્ષિત ખૂણે શાંતિથી ઝળહળતો હોય છે. You know, and these are experiences from my own life, I am telling you. આ બધું. હવે forget all that. I was 21 or 22. I remember Nadita Shah. મારે એક ડોક્ટર અત્યારનું બધું બહુ ડિફરન્ટ થઈ ગયું છે. તમને યુ આર ઇન્સ્ટાગ્રામ, ટેલિગ્રામ, વોટ્સએપ, ગોડ નોઝ હાઉ મેની ગ્રામ્સ એન્ડ વી હેડ નથિંગ. અને મોબાઈલ ફોન્સ બી નહોતા. અને અમારા ટાઈમે જે 5-6 મોટા ડોક્ટરો હતા ને, એની પાછળ લાઈન લાગે સ્ટુડન્ટ્સ. એટલે તમને એઝ એન અસિસ્ટન્ટ 2 વર્ષ વેઇટિંગ લિસ્ટમાં રાખવું પડેલા. ઓકે, અને ત્યારે ખબર જ નથી ક્યાં કોણ ક્યાં છે. અત્યારે એવરીથિંગ ઇઝ વી આર આવરસેલ્ફ ડુઇંગ સો મચ ઓફ ઓનલાઈન ટીચિંગ, ફ્રી ટીચિંગ. એ ટાઈમે એવું કંઈ જ નહોતું. અને યુ નો ધીસ રૂલ, રાઈટ? આપણે બધા શું છે, વી આર મંકીઝ, નો? બંદર. ફાઇનલી તો આપણા પૂર્વજ બંદર હતા ને, અને બંદર પોલિટિક્સમાં તો એક્સપર્ટ હોય, રાઈટ? બરાબર? ચાપુસીગીરી, પોલિટિક્સ. તો જે ફેમસ માણસ હોય એની આજુબાજુ કોણ હોય? એની આજુબાજુ ચાપલુસ લોકો જ હોય, રાઈટ? એટલે અમારે જેની સાથે કામ કરવું હતું એની આજુબાજુ એવા જ લોકો હતા કે અમે તો એમના સુધી પહોંચી જ ન શકીએ. You understand? But I knew I wanted to study with one doctor, very famous homeopath. I don't want to name her right now, but very famous homeopath. Very મારે આમ તો આમની સાથે કરીને બહુ મહેનત કરી, and I never gave. That is the other thing. You keep, it will come. You have to keep doing. You have to keep doing. Finally, મને એક તો એમને મળવા જ ન મળે. right? Because there are so many people around, you don't get a chance to talk. Finally, when I got to talk to her, she said, sorry, મારી પાસે 2 વર્ષ સુધી ટાઈમ નથી. ઓકે, મારે તો 25 વર્ષમાં બહાર જઈને શીખડાવવાનું હતું, 20 તો ઓલરેડી થઈ ગઈ હતી, મારી પાસે બી તો ટાઈમ નહોતો. You understand? She said, મારે તો 2 વર્ષ ટાઈમ નથી. And then I tried other things. We used to write articles, Sachin and I. We used to write free time my college. We used to write articles. We used to try organize seminars. જેને જે કામ કરું સર હું હાજર છું. This is what gives you the opportunity. Universe sees that you are working hard. Finally, that doctor met me. मतलब when I met her, it was through someone I asked कि भाई हमारे पास है 6 के नहीं vacancy. Forget that. She didn't meet me. Finally, I met her in the ladies' toilet in another seminar. एक सेमिनार अटेंड करवा गई थी and madam was a speaker and she forgot the way to the toilet for the speakers and she came to the general toilet, ladies washroom, and I for some reason was also there. Okay, and she met me and the first thing I'm standing outside ladies washroom and I'm telling madam मैं तुम्हारे साथ काम करूँगी. She said, oh, you know what? My assistant, 2 વર્ષ સુધી હતી. मतलब I had just appointed a new assistant. She's gotten pregnant. I am looking for someone very good, and I think you are very enthusiastic. I will take you. So my appointment happened in the outside the ladies' washroom. क्या थी मर्सन तक? Now you can clap. This is interesting. I will never forget this. Yeah, I wanted to work with her, and so you see, you never know how the universe is going to give. You have to have the faith that you will get. But for that, you focus on giving, working. Now, Sachin said, don't wait. So giving is what? You are already doing this. You are studying. અત્યારે તમારે giving is you are studying. College માં જે events હોય, whatever you want to, help your professors, help your teachers, take part. When you have free time, we have free videos on our website. 30 hours of free videos. Don't watch reels, watch that. We put, you also put quizzes and everything, right? So, જેટલું તમને information આવી રીતનું મળે છે, you try to watch that. To keep some time for rest also. I am not saying કે આખો દિવસ તમારે 16 કલાક કામ કરવાની જરૂર છે. પણ જે 8-10 કલાક તમારા awake અને working હોય, એ full concentration માં give it to your vision. Let me put it like that. Your vision may be different than mine. Yeah? Whatever your vision is, put it to it. Just remember these very important things because these are the only ones that will make you successful and nothing else. Along with organon, I think there should be this lecture also in the homeopathic part. How to be successful. Right? Organon is philosophy. This is also a kind of philosophy. Especially needed in today's world. Okay. So this was just a couple of things I wanted to tell before we start. Now I'll very quickly show you some cases to show you how successful and effective homeopathy can be. Okay? Now this is a case of wart. It's a periungual. Ungual એટલે કે જે તમને nailની આજુબાજુ થાય. It's not fungal, it's a viral wart, but nailની આજુબાજુમાં. This child is 5 years old. ને 1 વર્ષની હતી ત્યારથી એના છે. તો એની લાઈફના 4 વર્ષથી એને આ વોટ છે which has not gone with Ayurveda, with cryotherapy, salicylic acid. She's gone to the best dermatologist, Bombay Jaslok Hospital, Hinduja. These are all the best hospitals. The Ambani hospitals, yeah, it was called Harkisan Das at that time. So, a badi hospitals ma best dermatologist ne mali avi છે અને આ છોકરી છેલ્લા 4 વર્ષથી she is struggling with this wart. You see how bad it looks. It is on her thumb. Okay, first digit. After 5 digits, so have na in a thumb cut. I started treating her. I'll tell you the remedy, but just see the improvement. Huh? Very simple. થોડું ઓછું થવા માંડ્યું. By 18th December, it's much less. Actually, pretty light. હજુ ઓછું કરશું ને તો it will be clearer, I think. By 18th Jan, look at how less it is. હવે જો. From what it was, see. From what it was in October to November, December, every month I am giving her a remedy. Jan, Feb must see how little it is now. Sorry, not Feb, this is still Jan. By 5th Feb. Okay? And this is after 1 year. So the child, still I have a follow-up once in a while, because the family follows up. That what? Once it was treated homeopathically, it has never ever come back. 13 years now. Huh? And from October, by February, by Jan that year, so about 4 to 5 months, I'm completely gone. Something which she tried everything and a 4 varas sudhi, it never left her. And this is the power of homeopathy. I still remember the grandmother of the child always says, "Hey, you are my God." And a chokri avo haath laine kyaai jai nathi sakti. School must imagine the taboo and trauma that your 5-year-old has. Koi parents eની chokri સાથે વાત na કરે. Nobody was talking. The child was getting more and more irritable. The child was being isolated. And in about 4 months, it's completely gone. What was the remedy I gave the child? So, what are the common remedies? Thuja, silica, causticum, antimony crude also sometimes is given. Yeah? But you have to see what are the most important symptoms in a case. I'm also going to talk about mind and body both. Yeah? Now what is interesting in this child, if there is a remedy there, third remedy, Calcarea silicata. You see it has a weird rubric. Extremities, watch, fingers, first, thumb. And only 8 remedies are there. You see that? Single mark. 8 remedies mati. Thuja ma bhi chhe. But thuja, the child had bottles of thuja over the counter prescription. Silica, thuja, the grandmother said, "Amari paase 6 potencies. Tamari paase no hai to amari paase thi lai jao." Slight difference that a homeopath does is I give Calcarea silica. Why? What did I tell you? Where was the what? Thumb, first finger. Another interesting thing about this child was she had very cold, clammy hands and feet, which is the characteristic. Silicata even more. એને બહુ ઠંડી લાગતી હતી. She was a chilly child and quite shy, timid, but also very irritable. And the mother used to say, "Baar jaye to bahut shy." When she would come to the clinic, I have purposely not shown the video and the face and everything to keep the privacy of the child. Now she's a teenager. When she would come to the clinic, the English shant, there was silica, has this rubric, shy, timid personality. The shant base, bole nahi. She's also very rigid. another thing about silica is that they can be very, very rigid, fixed ideas. Yeah? So they can be shy, but they will not change their ideas or their plans. That is characteristic to silica. Sachendra, I had one case of a little child, again 3 years old. 3 વર્ષની છોકરી, she was 3, you know, when she came with tonsillitis. 3 વર્ષની છોકરીને clock જોતા આવડે? Almost નહીં. 3-year-olds cannot tell the time. અને exact time કે અત્યારે 7 વાગ્યા છે, 8 વાગ્યા છે, 9 વાગ્યા છે. That child had come to our clinic સાંજના 7:30 વાગ્યા હતા. We were taking a new case. And suddenly she said, "Ghar jana hai." I'm talking of another case to explain you silica fixed idea. So that child, she said, "Ghar jana hai." So I told the mother, "ये bore हो रही है क्या?" Sachin was there, so we said, "ये bore हो रही है." नहीं, bore नहीं हो रही है. The mother said, "उसका खाने का टाइम हो गया." तो I said, "अच्छा, उसको पता है?" Then that girl said, "हाँ, 7:30 बज गया, मेरा खाने का टाइम हो गया." Then we asked the mother, इसको कैसे पता 7:30 बज गया? इसको घड़ी देखने को सिखाया? तो the mother said, नहीं, ये बायोलॉजिकल क्लॉक है इसका. हमने एक बार सेट कर दिया ना प्रोग्राम. Silicon chips, no? We have silicon chips in our computer. Once programmed, they work amazingly well, right? That is a silica personality. कि एक बार उसके दिमाग में वो प्रोग्राम बैठ गया तो दे लाइक टू फॉलो. तो मदर उसको घर में जब 7, 7:30 को खिलाती है, 7:30 को, द चाइल्ड नाउ हैज अ बायोलॉजिकल सेट टाइम. 7:30 बजा ना बजा उसको पता चल जाता है कि खाने का टाइम हो गया है. सिमिलरली शी गोज ऑल्टरनेट डे, मम्मी दही देती है तो वो ऑल्टरनेट डे को ही दही खाएगी. शी रिमेम्बर कि कल दही दिया था तो आज दही नहीं खाना है. स्कूल में बर्थडे हो तो भी यूनिफॉर्म पहन के ही जाएगी, क्योंकि एक बार उसको बता दिया है कि स्कूल में आदमी यूनिफॉर्म पहन के ही जाता है. सो दिस इज अ सिलिका पर्सनालिटी एंड दिस चाइल्ड वाज आल्सो लाइक दैट. बट सिलिका हैड नॉट हेल्प्ड दिस चाइल्ड because there was another side to it, which was the calcarea personality. Okay? When you look at calcarea silicata in the materia medica, they are shy, but they are also very eager. And they don't know what to do. They are confused because that is calcarea. Calcarea, like magnesium, like baryta, they are all, if you look at them in the periodic table, they are second column. Okay? And they બધા જ એવા હોય છે, થોડા indecisive, they need support, they don't know what to do. And this child, the mother said, when she is at home, either she is very shy, but when she is at home and if she doesn't understand anything, then she is very tantrum throwing, she doesn't know what to do, she is confused, and the father is exactly like her. So I took the father's history and he also turned out to be calcarea silicata. Okay? Very irresolute, fighting, dependent on the wife on one side, but also needs to do his things at his time. And of course, father also had sweaty palms. Okay, but that was just, we came to know, it didn't help us from the child, we anyway had the history. Perspiration profuse. Okay, our father had some other interesting things, anxiety about family, yielding disposition, so I took those movements. But I have given her calcarea silicata in a 30 potency every month and then got this result. Yeah? So this was just to tell you how homeopathy can work in very difficult cases. Yeah? Or cases where, in fact, I love cases where others have failed. Because you know it is going to be a different remedy. You know कि आमे बधाए तो खराब कर दी चलो तमें बीचू सु करी सकवाना था खराब. You can only now make it better. When so many have failed, you don't have fear of failure. Are you with me? So those are cases you must always take up. Because then you have an upper edge. You can find something different. Yeah? So this was just one example. Now I will show you, I'll tell you one case of cancer recently, which is doing very well. It's a simple remedy. This woman recently has come to me 6 months ago. एक दो rare cancer है, papillary thyroid cancer. Okay, but it is almost grade 4 and metastasized. She is the wife of a radiologist herself in a foreign country. Okay, and on a routine examination, they found out. Of course, then they saw that there was a history. She had a little bump here, which is clearly a bone growth, metastasis of the same cancer. She has it in the back. She has it in the lymph nodes. She had a bit of hoarseness of voice. Okay, that was one symptom. And a weakness thodi thati. And they had a routine, and on the routine came out that she has a grade 4 cancer. It is spreading dramatically, and she has only few weeks, few days to few weeks or whatever. She did do well on chemo. Okay? And that is how, so she responded very badly to chemo. Her, her white blood cells really started dropping. She started having very severe weakness. She had to be hospitalized, very high fevers. So they had to stop the chemo and they started a new thing called a TKI. This is a new thing, okay? Which is also similar to chemo. I don't want to go into all of that. But what is interesting is I took her case, okay? She tells me, okay, so she doesn't believe in the COVID vaccine. Okay, there have been instances of increased cancer, increased metabolic syndromes, increased strokes and everything post the vaccine, which is being examined. But her story is very interesting. Her story is she didn't want to take the vaccine and she took the 2 doses. Because it is compulsory, not 2, even 3, it is compulsory in the country she is living in. And she says, Doctor, you know what? I'm very, very suspicious of all these people. All these doctors and this vaccines and these companies, and I read a lot. And I'm somebody who is very, very alert. What is happening where, how things are happening. During COVID, I was constantly alert. કોણ શું કરી રહ્યું છે, ક્યાં શું થઈ રહ્યું છે, blah, 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 blah. I was constantly looking. Then she tells me, so I said, this is your personality that you are constantly alert? She says, yes, yes, yes. I have always like that. She says, you never know ક્યાંથી કોણ શું કરશે. This is my feeling from childhood. કેમકે નાનપણથી we were very young and they lost their parents very early, all siblings. And then she said, I got married in this family, so I always had a feeling that I have to be on my own. મારે તો મારે જ બધું એકલે કરવાનું છે. Now she got married into this family and she says, you know, this is a very big family. પહેલા મારે કોઈ નહોતું. So I married in this family. અહીંયા બહુ બધા relatives છે. But they are all against me. They are all against me. And they are different. So she's married. It's a love marriage. Okay? So she's an Indian NRI kind of a thing. So that big side of the family was always in that country. And she says, they talk amongst themselves. They are always trying to say something behind my back. They never appreciate what I do. They're always trying to find faults in me. When I and my husband go and meet them, they want to find out कि इसने ये गलत किया, उसने वो गलत किया. I am not like that. I am very nice. I am very sweet. But this whole family is like that. And then I realized as she was talking to me, she was telling me, you know, that doctor is also like that. The one whom I am meeting, that TKI doctor, he says one thing, he does another thing. Then she said, you know, then I went to that holiday. Then I went to the holiday and I was checking in. That lady at the counter was also like that. So today's world, no doctor, you can't trust anyone. And I think it's from this vaccine only that I have got this cancer. I don't think she's gotten it from the vaccine. What I think is she's gotten it because of you're getting it, tell me. The suspicion that she is building in her that the entire world is against her. You know? Or that she is at a complete disadvantage. No? She has to always be alert. Okay? She had some very peculiar physical symptoms. Wait, we go past. She had some very peculiar physical symptoms with the cancer. She had lost a lot of weight now with TKI and all of this. Stomach appetite was diminished, fullness. This was very interesting. Lie down inclination to eating after. She said every time that I eat something, I collapse. I have to sleep. અને આ મારી આદત નાનપણથી છે કે હું ખાઉં ને પછી હું સુઈ જાઉં for hours together. Taste bitter she had from all that excessive TKI and chemo she had done. Yeah? Palpitations, walking. She also had liver symptoms, so clay-like stools. She had then couple of other things. And retention of urine. She couldn't pass urine after all that TKI. But what is interesting is that one special rubric, lie down inclination to eating after, and it's only 17 remedy. But you see the remedy that comes up. Lachesis. What is lachesis? Snake venom. Yeah? What? So it's made from the venom of the American surukuru, right? It's a viper snake. It's a viper category. Naja is a cobra, is an elapid category. Now you know the thing. What is the symptom of lachesis from the materia medica? Most important symptom that we all know. Suspicious, right? Do you know why lachesis is suspicious? Or do you know what brings so much suspicion in lachesis? No. So this is, I think, this is how I'm going one step beyond. This is how we understand the symptoms and the source. Now imagine a snake in the wild. Okay? Compare करो एक snake ने और एक mammal ने. Okay? आपने compare करें. These are the most evolved. The snake and the mammal. Mammal takes care of their children. Snake? No. Snake meaning all reptiles. reptiles also do that, and that is nature's way. How many, you know what, mammal and bird, let's put both together. Mammal and bird, na bachcha kitla hoy? 2, 3, okay? Not more, 1, 2, 3. Reptiles, bachcha kitla hoy? 50, 60, 15, 20. Nature's way of eliminating. કે જેટલા વધારે eggs હોય, care નહીં દેવાની, પછી એમાંથી એકાદ બે બચશે. મેમલ અને બર્ડમાં થોડાક જ હોય, એને ફૂલ કેર આપવાની, તો એ એક કે બે બચી જશે. You see the difference? See, let's put it like this. First, it was fish. આપણે vertebrates ની વાતો કરી રહ્યા છે. Fish. After fish came amphibians, and these are all remedies in the materia medica proved. We have remedies from all these in the materia medica. Fish, then amphibians, salamandra is a remedy. Then reptiles. Reptiles are all the snake venoms, lizard, lacerta, aegis. These are all proved remedies. Reptiles, pachi avya mammals and birds. So, mammals and birds are a much more evolved and sophisticated version. Are you with me? What is the reptile version? Your parents are not going to take care of you. Your family is not going to take care of you. You are alone. So what happens when you are alone? You have to be alert. અને આપણે એકલા હોઈએ તો મારી બેગ ક્યાં છે, મારો ફોન ક્યાં છે, મારું આ ક્યાં છે, મારું તે ક્યાં છે. We are so careful. So the alertness, reptiles are extremely alert. Do you know reptiles are even more better predators than the lions and tigers?
Yes.
In a reptile, the strike rate is 60 to 70%. In a mammal or a bird, the strike rate is 30 to 40%. Because mammal and bird has enough energy to keep trying again to hunt. Are you with me? But reptile, another problem. एक तो माँ बाप नहीं, support नहीं. बीजू reptile is cold-blooded. Mammals and birds are warm-blooded. Cold-blooded, you cannot waste energy. So what is the other symptom in reptiles? If you see Lecasis and Naja, they are very lazy because they conserve energy, and very often after a meal they will sleep for months together. This is a reptile. A reptile will have a big meal and not, especially snakes, will not eat for days, weeks, or sometimes months together. But once it has eaten, especially the snake, it has to lie down. It has to rest. This was exactly her symptom in the physical. But what was her symptom in the mind? I have no support, not only suspicion. So suspicion I showed you as a materia medica symptom, but I am going deeper to understand the person. What is her mind? Her mind is that I have no support from childhood. Yeah, I have to be very alert, and wherever I go, somebody is there to attack me. Whether I am at the counter at the airport, whether I am with my in-laws, whether I am with the doctor, whether I am with I was wondering about Mari Sathe kind of house. Because you see that very often a reptile patient may often have a fight with you in the clinic. This is possible. So the suspicion in a reptile comes from the fact that they are deprived, that they are treated unjustly. The whole world is against them. I started her on Lecasis in a 30 potency. Yeah, once a week. Her fever started to drop. Yeah, but TKI was continuous. We don't stop something drastically. And she's in another country. I will be soon. Okay? But she was not responding to TKI, she was not responding to chemo anyways. She was having 105 fever. Her fever stopped slowly. Her weight gain happened. In the next few scans, slowly they started to see that the tumor was dissolving. And the doctor, you know what he told? He said, I have never seen TKI do this to any patient. And then she said, really, genuinely, it's not expected that the TKI works like this. The doctor said, I have never seen any patient on TKI improve. Though we keep saying that TKI will improve, we know it will not. So I am surprised that you are alive, and I am surprised that now they are saying probably it was something else. How could it be something else when you initially started with chemo and TKI saying you have only a few weeks? Now, it's more than 6 weeks. She's still taking it every week in a 200 sorry, I said 30, no? 30, not 200. She's taking it in a 30 still every week. And now it is getting every scan getting better. The TKI has also been stopped because they are saying that it's getting better. Now they are saying we'll investigate you for something else, but that's another country I'm not going to deal with. But I know and she tells me, Acha, what is very interesting, she had glaucoma. And glaucoma, glaucoma is back to normal. She said, doctor, this is the first time you see a reptile giving you this feedback. She said, my doctor, and I told her, you are this remedy. And I didn't tell her you are this remedy. I said, you have to take this remedy because it's very good. And snake venoms are very good for cancer. She's taken it. She said, this is the one which is helped because her glaucoma has improved, her fever has gone, and her tumor is regressed. But another important thing, I told her, how are your in-laws? So this is where I want the change to happen. I said, in-laws came to Tamara. She said, Are, ye to bahut badlai gaya. I said, badlai ke bitne gaya? Nana, aap to tumhare thai kyun nahi kya? Mara husband, oh, she told me such a terrible thing about her husband. That he only supports them, he never supports me, and this and this and this. Now she says, ever since I got this, my husband totally wasn't supporting me, and then he told them that don't trouble my wife, I have full support from him. So very good. And she said, actually they were not bad for me. So what has happened here? Have the in-laws changed? But something has happened. What? Perception of the person. Now you know what? This happens only and only with homeopathy. आप हमने नहीं पढ़े एलोपैथी में आयुर्वेद में they are very good. I vouch by Ayurveda. I have seen some fantastic results. I don't disagree. But the way Ayurveda works is slightly different. You can also create this change on your own. Are you with me? You can create this change on your own. But it's very difficult. But once you take homeopathy, you see that patients automatically start to create this change. And when you see this result, also let's put it like this. What Sachin and I look for in every case is this result. You know, in the morning, when the research, Dr. Chetna was talking about how do you know that the remedy is working, you put down other parameters. The one thing that I know my remedy is working because I take the case of every person, I understand the story of every person. Like a Hollywood movie, like the Ranveer and Deepika movie. Now, how do we know the picture of Silicifuga by heart, 25 symptoms of Silicifuga? Anybody, एक भी mistake नहीं करनी चाहिए. All 25 symptoms, anybody can tell me? નો રણવીર દીપિકાની કોઈ એક મૂવીનું નામ કહો. રામલીલા. રાસલીલા. રામલીલા. હા, રામલીલા. એની મૂવીની સ્ટોરી કહો. Full, without mistake. I will have 20 hands. Because you cannot remember Simisifuga, but you can remember Rasleela. Because Rasleela is Rasleela. પેલો આવ્યો, પછી પેલી શર્માળી, પછી પેલો વિલન આવ્યો, પછી પેલા ગુસ્સો માર્યો, પછી આમ કહ્યું ને તેમ કહ્યું. રાતના 2 વાગે બી હું ઉઠાડીને પૂછીશ કે રાસલીલામાં શું હતો, ડાયલોગ તો બધા કે Simisifuga તો ક્લાઉડ ઓવર ધ હેડ ક્લાઉડ જ રહી જશે. Now, why Sachinda and I remember our cases? Sometimes in our cases we never need any PowerPoint. We don't need, मतलब 20 વર્ષના બધા જ cases યાદ છે મને. Because every case for me is a Rasleela. You understand? Every case, and this is the beauty in homeopathy, and this is the beauty when you practice it at this level. You will remember your patient, you will remember your story. Every remedy is a story. Now today I don't have the time to tell you, but Calcaria silicata is a very beautiful personality. Naja is very beautiful personality and different from Lachesis. Crotalus is even more different. How you can differentiate Alia Bhatt from who's that? Deepika, from Katrina, from Kareena Kapoor. Like that I can differentiate Crotalus from Vipera, from Bothrops, from Naja. Understand? And when you practice homeopathy this way, you will love it. You will enjoy every day for Sachinda is enjoyment. You know, we have not slept last night, both of us. અમારે એક બીજું ઇવેન્ટ ચાલી રહ્યું હતું, એ પછી અમારા ઘરે મહેમાન હતા. રાતના 11:30 અમે એ લોકોને એરપોર્ટ મૂકી અને 2:30 વાગે ઉઠીને 3 વાગે અમે એરપોર્ટ પહોંચ્યા છીએ. બટ વી આર અપ એન્ડ અવેક એન્ડ બ્રાઇટ, એન્ડ ધીસ ઇઝ અવર એવરીડે લાઈફ. Forget this, guys. I want you to feel so passionate that you can recreate it in whichever way you want. You understand? You don't have to follow our passion. You do what you want, but follow it with passion. And I tell you, you will be able to charge your patients. You will be able to get a lot of patients. Forget all those fears કે હોમિયોપેથીમાં ઓછા પૈસા છે. હોમિયોપેથીમાં આપણે કેવી રીતે પેશન્ટને ક્વેશ્ચન પૂછશું કે તારી સાસુ પર નામ કરે છે તો કેવું લાગે છે, રાઈટ? આપણે કેવી રીતે forget those fears. Be in that confidence, understand your remedies as your student and feel it, and you will see that you will be able to generate the revenue, the response, everything is possible. Yeah? I think I will stop here because it's late also. We have many more cases, but we can always do it for another time. But I think the message has come across, which is most important. Yeah? Thank you so much.
Thank you so much, Sachinda sir and Bhavisha madam, for enriching and insightful session. As a mark of appreciation, we would like to felicitate our esteemed speaker with memento and certificate. I request Dr. Pankaj sir and Dr. Sujit sir to kindly come on the stage and present the memento and certificate to Dr. Sachinda Joshi sir.
the thing. Eat faster to think.
Now I request Dr. Arpita Madam and Dr. Kirti Madam to kindly come on the stage and present the memento and certificate to Dr. Bhavisha Joshi.